Hi everyone, I'm Dr. Sam Price. I am your licensed naturopathic physician. I am your expert in natural medicine and natural health care. I help you bridge conventional and alternative medicine to transform your illness into wellness. And today we're going to talk about essential oils. What are they? What is all the hype about, right? Well, there's good reason that there's hype about it, and I'm going to share it for you. I'm also going to talk about what are they, how do we use them, and then I'm going to share my five favorite ones. Okay, so hopefully you guys can understand them a little bit better after I talk about them. What are essential oils? Essential oils are actually not oils, believe it or not. They're actually extracts. So they pull an extract from natural substances. So seeds, bark, flower, leaves, twigs, roots, that's where we're pulling these essentials from, okay? So they're not oils because they're fat soluble. Fat soluble elements actually penetrate into the cellular layer, all right? So they're penetrating into your cell. Once they're in the cell, they are actually able to distribute all throughout the body. So that's the reason why they're so wonderful. They're penetrable. It helps all tissues and organs if it's actually penetrating into the cellular layer. So this is exactly what essential oils are. So let's talk about how do we use essential oils. So there's 3 different ways that we're going to use the essential oils. Number 1 is topical, number 2 is ingestion, and number 3 is inhalation or aromatic. So let's talk about topical first. Topical is very easy to do. You want to do a couple of drops. You can put it right onto your skin area. There are very small little things called capillaries underneath the skin layer. It will actually penetrate to the skin layer, to the capillaries. It'll help that area that you place the oil on, and it'll also spread because the capillaries will take it to other places. Okay, so there's a couple of things that I want you guys to know about topical. So some people have skin sensitivity, so let's be aware of that. I don't necessarily promote using things neat, is how we call it in the essential oils realm. So the essential oils, neat means you're using the oil just by itself. I like it when you use a carrier oil. So let's talk about carrier oils. If you think of any kind of nut oil, macadamia oil, walnut oil, almond oil, hazelnut oil, those are carrier oils. You can also use let's see, olive oil, sesame oil, avocado oil, if you think of cooking oils. So my favorite one to use is coconut oil. So I suggest you put a couple of drops of your essential oil into a carrier oil that I just named, rub it together, and then you can use it topically, okay? So great ways to use it topically. The best way is at the bottom of the foot, believe it or not. I know not a lot of people know this, but they're really large pores at the bottom of your foot, and you can get a lot of work done from rubbing it at the bottom of your foot, especially in infants and children. Okay, so if you have sensitive skin, I want you to rotate the area topically that you're using. So you're going to start at the bottom of the feet, then you can do your ankles, your knees, the side of your abdomen, the side of your chest, then the chest area, and then your wrists. Okay. Some oils should not be used topically because they're hot, so that means neat. So you would want to do them in a carrier oil. So let's talk about ingestion. So ingestion is when you're actually taking the oils internally. This is not my favorite way, but I'm going to tell you about it. The safest way I think to do it is to take the couple of drops of oil. You can put it into your tea, your water, your juice. You can put it in yogurt, and you can put it in honey, and this is how you would take it orally. The other way that people take it orally is that you can take a veggie cap, you open up the cap. These are caps that you buy that are empty, okay? You're going to take the cap, you're going to put oil in the cap, and then you're going to close the cap, and you take it like a pill. Okay, so let's talk about, since I've talked about topical and ingestion, let's talk about how many drops are appropriate for what type of people. So for adults, the average is 4 to 5 drops. Okay, so if you're putting it in a cap, 4 to 5 drops. If you're putting it in your tea or your water, 4 to 5 drops in an 8-ounce glass. If you're putting it in a carrier oil, 4 to 5 drops. That's what I'm talking about. For Adolescents and teenagers, we think 3 to 4 drops, okay? For children and infants, 1 to 2 drops. And the difference between the infants and the children is infants, you want to dilute it, please, okay? These are definitely medicinal in their properties. So 1 to 2 drops for children and infants. Infants need to be diluted. Adolescents and teens are 3 to 4 drops. All right, so now let's talk about my favorite way to use essential oils is aromatic or inhalation. All right, so the reason why I love this is that it's multifold. You can get so much more bang for your buck this way. So inhalation is where you're actually sniffing in the aromatic fragrance of the essential oils. So you actually have it go through your olfactory senses. So you have your eyes, your ears, your nose, and your throat. There are canals within this area that all kind of come together. And when you're inhaling it, it actually goes into the limbic system of the brain. This system of the brain is actually responsible for learning and memory and things like that. And it actually influences our nervous system. It influences our hormones. It influences libido and sleep. So you're getting a lot of bang for your buck when you're actually inhaling it. So then after it goes to the limbic system and it works on all these wonderful systems, it actually goes down into your lungs as well, where it attaches to the alveolus cells, and then the alveolus cells take them to the heart, and then the heart pumps it out to all the different organs and tissues of your body. So you're getting it all over without having to ingest it, without having to put it on your body. All you have to do is sniff it, okay? So the ways in which we do inhalation is you can actually just take a bottle and just put it underneath your nose. That's one way to do it. You can actually use diffusers. These are really popular now. So here's one that's from my house. You put the oil at the top, and then you have a tea light here, and then you will burn the tea light, and then the fragrance is in the house, okay? The other way is that you can spray it as an air room diffuser or a fragrance. You can actually open the bottle, put it on your palm, rub it together, and then smell. The other way I like is I have a diffuser necklace. So you actually open it up and it has like a little pad and you can put the oil on it and you just wear it around your neck. So that's aromatic or ingesting. So when you read the back of the bottle of your essential oil, it should say aromatic, dietary, and topical, if you can use it all 3 ways. If it doesn't say dietary, that means that you cannot use it orally. You cannot put it in your tea. You can't put it in your water. You cannot put it as a capsule, okay? It needs to say dietary in order for you to actually use it as ingestion. All right, so let's talk about the 5 essential oils that I've picked to explain to you guys today. So I didn't want to miss anything, so I wrote down a couple of little notes for you guys. So the first one is peppermint. Wow, there's so many uses for peppermint. So peppermint is great for pain. It's great as an antibacterial, an antifungal, an antimicrobial. It's used as an insect repellent. So you could put some peppermint in something like this and kind of just spray it. You could spray it on yourself because yes, you can use it topically. It's great for asthma. It's great for fatigue. It's great for headaches. It's great for indigestion. So you think about peppermint tea, you know, when you're nauseous. It's also great for mental alertness. What I did want to make sure that I tell you guys is that this is not safe for use for people under the age of 6. Okay, and it's also not good if you are pregnant. So I know we think of peppermint tea and whatnot for pregnancy. That's fine. You don't want to use peppermint oil when you're pregnant. Okay, so one way that I like to get it in with the peppermint is Castile soap is great. You could get plain Castile soap if you want to, and you can actually put in some peppermint oil, and you can wash your body in the shower with peppermint. So this is great because you're rubbing off all the bacteria, all of the fungal stuff, all of the stuff, you know, from the day, whether it's at night or in the morning. It also helps with mental alertness. It helps to clear the respiratory system. It's a great wake me up in the morning. So this is pure Castile soap. It's hemp peppermint, so I like this. It also, you're getting the inhalation of the aromatic smells of the peppermint, and you're also getting it topically, which is 2 for 1, right? So that's great. Tea tree oil. So tea tree oil is the best at fungal stuff. So fungal is warts, dandruff, rashes, thrush, like the white coating on a baby's tongue, diaper rash. So if you think of Selsun Blue, the smell of Selsun Blue is really tea tree oil. Okay, so any kind of fungal infection, tea tree oil is great. Jock itch. So if you've got an athlete, tea tree oil would be great. I actually suggest that they wash in Selsun Blue because it has the tea tree oil in it. You could always get plain Castile soap and put some tea tree oil in it, and that'll help with fungal infections. It's great for cold and cough, okay? Also great as a disinfectant, so put some in here, spray your counters down. Dental health, it's fantastic for dental health as well. So you want to swish because you do not want to do tea tree oral ingesting it. You don't want to swallow it. So you can swish it around in your mouth and spit it out. I don't suggest you do it internally. So don't put it in the cap and don't swallow it. It's great for oily hair and for oily skin. So you could put a couple of drops into your moisturizer. You can put it on there. Also great for your hair. So that's why Selsun Blue uses it. Because once you have a lot of oil, that can cause fungal infections as well. All right, so the third one I want to talk about is lavender. Oh my gosh, I use this. I think I prescribe, this is probably the most prescribed one that I use. So lavender is fantastic for acne, all right? So you can just put it in a carrier oil and put it on the acne spots. Actually, lavender is one of those that you can use neat. Okay, and what I mean by neat is you can use it without a carrier oil. It's one of the safer ones. So peppermint and lavender are the two that I'm pretty safe with you using neat. So lavender is great for acne. It's also great for pain. So I had a patient to actually explain to me how they found out that lavender was okay for pain. So what happened was there was somebody in a lab and something exploded in the lab, and it just so happened that they had like a vat of lavender over on the side, and he burned his hand, and the only thing he had was lavender. So he just stuck his hand in the lavender and he got no blisters, had no pain. So lavender is definitely scientifically proven for pain. It's also a great insect repellent. It helps with anxiety, depression, and stress. So also great for nausea, also great for migraines. So for pregnancy, because the peppermint's not, you know, okay for nausea, then I would say the lavender for sure. This one's more for migraines. Lavender's more for migraines than just your regular headache. Headache would be more peppermint. Since I do oncology, and that's my specialty, I did want to share some cancer tips with you guys. Lavender is absolutely contraindicated in estrogen dominant breast cancer. Okay, so whatever they told you, please don't use lavender if you have estrogen dependent, that's ER positive breast cancer. I use lavender as you can spray it on your pillows to help you sleep at night, whether that's having issues getting to sleep or staying asleep at night. Another way that I like to use lavender is in the shower. So if you're taking a shower at nighttime, you can do the Castile soap in the lavender, right? You're gonna rub it on your body. That actually helps you to calm down and rest. It goes through the olfactory senses and the limbic system. And remember I told you that the limbic system actually in the brain helps you calm down, all right? Another way you can do it is you can put a couple of drops in some Epsom salt and take a nice warm bath. So lavender is one of my favorites for sure. The next one we're going to talk about is frankincense. Frankincense is hot on the market. I think everybody knows about frankincense. It is a wonderful smell. I wish we had smell-o-vision. Wouldn't that be cool? So frankincense is fantastic for inflammation. Woo! Okay, so if you think about inflammation, we think of any kind of ailment, right? So we think of pain. We think of cancer specifically. We think of oral health, okay? And we think of upper respiratory infections. We think of upper respiratory infections like bronchitis and colds and cough and things like that. And this is highly touted in the beauty world right now for skin issues. So you'll see, you're going to see it coming out in the market where a lot of beauty products are now going to start adding in frankincense essential oil because it's an anti-aging product. So for cancer specifically, I like it in a carrier oil, and you're going to rub it on the area where the cancer is. So we'll talk about minor issues and chronic issues in a minute after I get through the last oil, but frankincense is really hot. If you think about inflammation, and inflammation is the cause or the root cause of a lot of different ailments, then frankincense is one that we should definitely be using. It should be in your arsenal. It should be in your kitchen cabinet or in your bathroom cabinet. So I wanted to talk about one blend. So all of the oils that I talked about today, the peppermint, the tea tree oil, the lavender, and the frankincense, those are all what we call single oils. There's nothing else added to them. And then there's something called blending oils or blends. I do not suggest that you blend oils if you're not familiar with oils. They are volatile, they are very medicinal, and I don't want you to get hurt. So unless you have some experience with oils and have been trained in oils, don't blend your oils yourself. You're welcome to get blended oils though. So I did want to talk about one blended oil that is one of my favorites. It's called ProShield. ProShield is a blend of cinnamon, clove, orange, rosemary, eucalyptus, lemongrass, and lemon, okay? So ProShield is fantastic for germs, basically. So you can use it as a disinfectant. You can actually put it in a spray bottle and you can clean the house. You can spray the air. I put it in my my locket, my diffuser necklace, and I actually wear it on the plane, or I'll spray the plane. So it's for wellness. I also, especially when my bonus son Jay was sick, I would put this in the top. I would put the ProShield on the top, the oil on the top, and then diffuse it in his room and close his door. So it kind of like is a quarantine section, so that just his room is getting aired out and disinfected. So, and he actually really likes the smell. He asked me about it when he got sick. He was like, where's the oil? So it actually smells fantastic if you think about the blend, cinnamon and clove and orange and rosemary. It's a fantastic blend. So I like ProShield. Okay, so let's talk about how often you use this. So for minor issues, you're gonna use it every couple of hours. You can even use it every like 15 minutes or so if you want to. Okay, so those are for minor issues. So let's talk about headaches. So let's say we're using peppermint oil for a headache, and you're rubbing it on your temples, or you're rubbing it somewhere so that you can get rid of a headache. Once the headache is done, you can use it up to 2 days after the headache. You can use it every 15 minutes, or you can use it every couple of hours. For chronic issues such as cancer or knee pain or back and joint issues and things like that, the rule of thumb is for every year that you've had the issue, you need to give the oils 1 month. For every year that you've had it, you need to give the oils at least 1 month, okay? So, and then after that issue has subsided, so let's say joint pain or something like that. So that is essential oils. So let's go back over them. Peppermint, fantastic for insect repellent, pain, fatigue. I like to use it in the shower, washing in the shower. This is tea tree oil, great as an antifungal specifically, so jock itch, warts, dandruff, thrush. Also great as cold and cough, also great as a disinfectant, oily hair, oily skin. Lavender, fantastic for sleep, rest, calming yourself down. It's also really good for pain modulation and for acne. Frankincense is touted great for inflammation, cancer, upper respiratory infections and skin issues. ProShield, wonderful as a disinfectant for germy type things. So wear it when you're, well, as a physician, I wear it in the clinic for things that are coming in. So I'll diffuse this in the office. I'll also wear it on my locket. So those are the 5. You can also put lavender, you know, as a wash. So the 3 different ways in which we use it are we going to use it topically, so you can rub it on your skin, use a carrier oil. You can do ingestion. You can drip some drops in your tea or your water. You can also put it in a cap and ingest it like a pill. And then my favorite is inhalation or aromatic, so you're going to use a diffuser. You can use a reed diffuser if you want. You can use the new kind where you can actually see it coming out. You can use it on your clothes. You can just smell it on your hands. You can use it in here. You can also put it on your clothes. And you can also wash your clothes with it. So if you think about it, I've seen a lot of dryer sheets now that have lavender essential oil added to them. So those are the 3 different ways that you can use it. Those are my 5 essential oils. I'm always available. You can catch me at DrSammND. That's DrSammN as in naturopathic, D as in doctor.com. Have a great day, guys. Bye.